So, Professor Giancarlo Comi, he is the chairman of the Department of Clinical Neurophysiology and the director at the Institute of Experimental Neurology at the Scientific Institute San Raffaele in Milan and president of the European Charcot Foundation. Dr. Temitope Farombi is a neurologist at the Chief Tony Aneni Geriatric Centre, University College Hospital, Nigeria. And her practice specialises in the critical care neurology of the elderly, movement disorders, dementia and headaches. Dr. Orla Galvin is Executive Director at the European Federation of Neurological Associations, known as IHME for short, which represents some 20 neurological conditions. Orla has a PhD in medicine, and then she transitioned into patient and public advocacy, research and policy. Please join me in welcoming our panel. So, to kick it off, what about the key challenges that are faced in terms of trying to address this whole area of these disorders on a global scale? What can be done? If I may, I'm going to use first names. Are we happy with this? Yeah. Great. Giancarlo, what are the big challenges? What are you doing about it?
Well, I have to say that the brain has been, for a very long time, a black box. Very difficult to understand what's happening inside the box. We had in the last 10, 15 years this revolution of molecular medicine. We are, with all the omics now, we are really approaching much more closely what happened. We are in the scene now where things happen. And I think this is really a fundamental step, because we have to face the unknown. For most of the neurological diseases, particularly my interest in the area of neurodegenerative diseases, which are complex diseases. Complex make very clear to us what we mean. Complex because there is a disease that is different, even in the same disease, is different from person to person because of a complex interaction of genetics and environmental factors. To disentangle individual contributions, then to find the right targets for the intervention has been an incredible challenge. And until very recently, we have no treatment for these diseases. So we start to see the light. And that's really due to the very special advances. And I was just thinking during the previous talks that it's very appropriate now to spend energies in the direction of brain health, because it's a special time. We start to have a possibility to target this condition, which was not really the case until very recently.
Thank you. Temitope, what would you say? What would you say the big challenges in terms of addressing this?
Thank you very much. Like he mentioned, it has always been the imaginary brain thing. And for us, in the Black world, in Africa, and in other places, we've not really conceptualized the concept of brain health and how it impacts our daily lives. Our society, the interconnection between society, what we do, what we eat, and how we present ourselves affects our brain health. And that is a major challenge, to be able to connect the dots between the environmental impact, physical health, our society generally, and access to education, to health, and to living well. And this brings a very broad picture of the problems that we are also already envisaging. One of the things that I'm going to talk about, like from where I come from in Africa, I heard Natalie mention 39,000 neurologists in America. I cringed when she mentioned that, because we have only 87 neurologists in Nigeria, covering 220 million people.
Wow.
And if you then put that in perspective, in Africa, we have less than 1,000 or 500 neurologists covering 1.4 billion people. So And there has been a lot of poverty, infection, that had actually put Africa and most low, medium income countries at a disadvantage. Even when a child is born, you are 26% disadvantage. So our challenges are enormous, starting from in utero, because of the environmental impact and the societal impact. And even when you're born, because of the issues of poverty, insecurity, and stress, you are exposed to all this, and it makes, by the time you are in your midlife, you are at even about 50% disadvantage. So you can see, if I pick, it looks like a gloomy picture, right? But I tell you, what we are doing today can actually stop the evil days on its track. And how do we mitigate that? Collaborative effort, generating data, creating awareness, like we're already doing here. Bringing everybody on the table, equity, inclusion, even in making decisions, even for our future. Thank you.
Gosh, thank you very much. And I was trying to do the maths there. I was trying to do the maths. I think you'd mentioned before, Temitope, that it was 1 neurologist for every 10 million of the population, is that right? Yeah. Wow. Thank you for that perspective. It's wonderful to have, you've got the ear today of this amazing global representation of people here today. So thank you for making those points. Orla, what do you see then as the main challenges?
So a lot of what has already been said, I would echo, but what I'd like to add is that awareness, education, and understanding is really needed. They're the roots of everything. If you don't understand what the problem is, how can we come up with any solutions? One thing that wasn't mentioned yet is that 92% of people living with neurological disorders globally are affected by stigma, living with this day in, day out. I can tell you in Europe, 2/3 of people actually do get access to neurologists, but they need to attend 3 neurologists before they are actually diagnosed. And the remaining 1/3, that could be 8 or 10 more clinical visits before they get a diagnosis. So education and awareness needs to be at the public level so people have an understanding to help eliminate some of the stigma. The education needs to be at the clinical level because we have over 400 neurological conditions. We've probably only mentioned 2 or 3 so far at the event to this moment in time. And all of these people need data, need evidence so that decision makers, the policy makers, the funders can prioritize and allocate funding appropriately. We know that globally, the ratio of people who are affected by a neurological disorder in their lifetime is 1 in 3. In Europe, that ratio is becoming closer to 1 in 2. So if you think this doesn't affect you, you're wrong. It does, and it will. And it fundamentally boils back down to awareness raising. We talked about social media earlier as well. We need for brain health, and one of the advantages of brain health, that phrase, being a state of the brain, would be of huge advantage to people living with neurological conditions. Neurological conditions, it's not popular, it's not trendy, it's not sexy, it's not cool, but everyone can kind of grasp brain health. So wouldn't it be wonderful to use big data to prioritize and make brain health popular so that those who do have the power to allocate funding and resources do so?
And that's a good point, isn't it, about the positive language there, about brain health, and where you touch on stigma. I find those statistics quite extraordinary. We might think that 1 in maybe 2, 3 of us might get cancer, and we sort of know that. Perhaps we all know somebody in our families who's been touched with cancer. I'm sure there are people in this room who have. And yet to know that that is also a similar statistic for neurological conditions is something that hasn't been got over. I blame the medical correspondents, actually, the journalists, who should have been making this much more clear. And actually, if I may, as a little side point, using data is really powerful. Once I was asked to do a story for World AIDS Day, 1st of December, and there was nothing much kicking around. And I rang one of the organisations, Terence Higgins Trust. I said, how many people in the UK are diagnosed with HIV each year? They gave me a figure. I divided by by 365, and I said 72 people today will be diagnosed with HIV. Did a piece to camera, got it on News at 10, and it was the statistic that was so powerful. And you've got the statistics. Well, maybe not enough data, and we're going to come to that, but those statistics that you've all given are incredibly powerful. So get on to the medical journalists, get the message out there. You've touched on education. And what about that evidence gap then, about the lack of data? Here we are, hosted by the IHME, who specialize in gathering data. Giancarlo, what's needed? What sort of real-world evidence, for instance, is needed to bridge that evidence gap?
No, this is a fundamental point. There is still a lot of unknown, and particularly when you want to represent, for example, at the government level, you must know what we are talking about in terms of dimension of the economic burden. So this is a very, very important aspect. We need to collect more data, and they have to be collected across different countries. We heard that, of course, there are different problems in different countries, but you can learn each other a lot if you co-divide and you share your experience. That's a very fundamental point. And second point is what you touch shortly. In a very recent meeting we had in Milan about neurodegenerative diseases, one of the proposals was to have courses at school, at high school, about brain health. And because we estimated that you can, for example, reduce by 1/3 the burden of neurodegenerative diseases with an appropriate education. So it is very surprising, but waiting for the solution, for the magic pill, we don't care about what you can do every day today. Even as a parents, sometimes you don't teach enough our sons and daughters about what can be the important factors that have to deal with in order to prevent problems. So education at all the levels is really a fundamental aspect. And again, numbers are very important to approach the government and to explain why you have to invest at this level, because otherwise it's difficult to penetrate and to have enough effects.
And to pick you up on that, when you say perhaps 1/3 of the conditions might be avoided by education, how? What would they have learnt and done to make a difference?
Well, we start to have a lot of data about, for example, the environmental factors. And by the way, they tend to be quite common for example, in different neurodegenerative diseases. And we know that they can be very clearly targeted with the appropriate type of interventions. It is incredible how strong can be the effect of this type of intervention. But to convince, to take such actions, you need really to come back with data that demonstrate that it gives an added value.
Thank you. Temitope, what would you say about collecting data, about the gap, the real-world evidence? What would you like to see achieved?
Yeah. Thank you very much. The digital age gives us the benefit to collecting data. In Africa, we have a growing population, a young population of about 70% of Africa, a young population who are very inquisitive, who uses mobile phones. And in recent times, we've seen a lot of them living in the virtual world. They live by it. And this is a very good tool for us to be able to collect neurological data and also to be able to teach and create awareness. You mentioned, Orla mentioned social media, the importance of social media, and bringing out positive language around brain health and neurological diseases. Let me give you an instance. There was one day I was just watching through YouTube, and I saw a mob action of young people, middle-aged and very old, against a woman who's got dementia. They were openly lynching her, and I became very emotional. That night, I cried on my bed. I didn't know this woman, but I cried. But I didn't stop there. That that spurred up an action within me. And then I coined the slogan, Brain Health Initiative. And that was how we batted Brain Health Initiative Nigeria. And the thrust of this is to create awareness using social media, also using print media and electronic media. I tell you, within a short period, we started getting calls from younger people about their grandparents who are having issues with dementia. People started coming out. We never knew. We thought this was something. Then that made us to create a campaign called Dementia Not Witchcraft, looking at the stigma surrounding. So the power of social media, the digital world that we have right now, gives us the opportunity to be able to bridge that data gap. And we cannot underestimate that.
Great point. And I wish we had the ear of Meta and Microsoft, for instance, today, because isn't that a great message? Orla, you touched on social media, and those are great examples then about how that can reach particularly young people and breaking down stigma. And I love the idea of dementia, not witchcraft, breaking down those stigmas, addressing them head on. Orla, what would you like to see then collected in data? What's missing?
So I suppose the two things that spring to mind is that, over the pandemic, the world and its mother decided that they were going to be experts in surveys, and I'm sure I speak for the majority of people when we say we've all experienced survey fatigue. But when it comes to people who are in need and people who desperately need change and active change in their lives quite imminently, they're not sick of giving their data. There is this misconception, a little bit propelled by GDPR around the scariness of sharing your data. I can tell you that for patients and families who are not living to their full potential because of a lack of resources, a lack of therapeutic intervention, a lack of access to all of the above, are more than happy and willing to share their data and information. We need to kind of stop this scaremongering around data sharing and data generation. It's not helpful to the patients and families who are affected by brain health conditions. And
that's a good point, because patient confidentiality, we have GDPR regulations, those are important, but there may be people who give up a lot of personal data when they join certain social media platforms. I talk to my youngsters and I say, do you realize how much you are giving away? And they shrug, they don't care. I try to wipe my data history wherever I go because I'm an old Luddite. But young people don't mind, and the big tech giants in this room will know all about that. They'll know where the boundaries are, and as you say, with patients, where they know the good effect in the long run, they're willing to contribute. Which brings us really to digitalization. An exciting time to be in any research field, I would have thought. I wonder how digitalization can help in this way. Giancarlo, what would you say? There's so much happening. We've got AI, we've got data collection, we've got things we wear on our wrists that collect data. How can digitalization, new technology, really help in this way?
I think it's changing the order of information we have, because the temporal sampling is incredibly increased. We see patients every 6 months, 1 year, and here we have data coming every minute, every second. Of course, we have to face the problem of handling a large amount of data, but the advanced technology, we heard one of the person before, how relevant is in the future this type of aspect, so the ability to handle gigantic data. And also, to tell you, I had the privilege to coordinate an European action in this area, and we have been surprised because it was extremely well accepted. We follow patients for 2 years, and 89% of the patients completed the 2 years. So it means that you may really utilize this tool, and the amount of information is incredible. It's now 2 years that we are continuously working on the data, because You have an incredible amount of information. Usually, you know, just to give a very stupid example, if you ask a person, how do you feel today? Well, the patient will refer the condition about what happened in the last 2, 3, 4 days, forgetting what happened 1 week or 1 month or 6 months before. And then you go back and you look at the data, you say, oh, but you didn't very badly, I have to see here. You didn't meet any person recently, you haven't exited home. So what happened? And then, oh, you are right, then you had this and this. So this is really something new. It can be seen, as you said, a bit invasive initially, but as soon as the person realizes that the feedback may be extremely positive, then the relationship may be very, very positive.
Gosh, yes, you remind me of an elderly relative of mine who kept saying, no, I'm fine, when the doctors asked. And eventually, because her generation was one that you don't complain, sure, it was cancer, luckily come through it well, but that sort of sense of not wanting to give the worst outcome, but as you say, if you can be monitoring step by step, day by day, then you can get that real world evidence that's going to make a difference. And Temitope, it was really interesting to think about, you were talking about the inequities of some societies. Digitalization perhaps could reach more people, particularly the young population you have, but then there's a question of access to the technology. So how do you square that one?
Yeah, thank you very much. I happen to be a founder of online health company, which is a digital health company, which was founded even during the pandemic, COVID-19. And what made me to start this company was because all our hospitals were shut down during COVID in Nigeria. We didn't have the logistics to handle it. The stigma around COVID, people were not coming out, and doctors were not willing also to see patients. And one of the things that we were able to do with the digital platform that we created was that we were able to allow people to talk to doctors, and even in the comfort of their homes, even as far as the rural places where there are no doctors. Only if you have a phone and a mobile app that we've created. I tell you, within 18 months, we have over 11,000 downloads of that platform, and we were able to do 35,000 consultations in COVID. It's a huge impact. Of course, it bridges the gap of access. And then, I tell you, this then creates the opportunity for redistribution of skills. We have neurologists, even this 87, mostly resides in the urban area and leaving the rural community out of it. And I tell you, those who are currently having symptomatic expression of neurological diseases, who are older persons, resides in the rural area. And then we've cut them up. So with the advent of digitalization, creating a platform like telemedicine, telehealth, we'll be able to redistribute skill gaps. Like our neurologists can still be in the urban center and still be able to reach a person with neurological need in the rural center. Of course, we still have our problems, but if we look at the statistics that we have in Nigeria, out of 220 million people, we have 180 million people having access to mobile phones. And that is huge. That is huge on our hands. And we have like 54% internet penetration. So if we bring health, digital health, we can actually help and redistribute this skill gap and then be able to bring in those who we need to bring in. Also, it helps us to be able to get the data and make an homogenized data, not a discordant data. One of the problems that we have is the problem of data, methodology, and the like in the part of the world I come from, and which makes policy or inference very difficult to make conclusions. But right now, if we can make digital collection of data more homogenized using digital platform. It makes interpretation very easy. And then you can monitor what's going on. You can, with what we have with the Brain Atlas, we can monitor, you can make inference, you can actually project. So the power of digital use in brain health cannot be overemphasized, it cannot be underemphasized. It's important and it has its use. It helps to redistribute skills. I've been here in the UK for a few weeks now. I'm still consulting back at home, despite the fact that I'm here in the UK. So that's the beauty of digital health.
And you mentioned the Brain Health Atlas, a sneak word. We're going to hear more about that anon, and that's going to be really, really exciting. And Orla, what about from the patient's perspective then? Does digitalization mean it's going to be much easier to just find out what you want? Dare I use a brand name talking about whether doctor knows best we used to talk about in the past, and now do we all do Dr. Google? Is that where we're going? But then there's the risk of getting the wrong information. So digitalization has got to be managed, yeah?
Absolutely. So with the best will in the world, every clinician and every healthcare professional, from patient organisations right through to your super specialists, are going to tell you, whatever you do, do not Google that. Don't look it up. Don't put it into whatever your search engine is. But we all do. We're all guilty of that. But to echo what Temi has said, that to bridge that gap between urban and rural divide, you know, digital solutions have been fantastic in that context, but then there's also a cohort of people, particularly the elderly, if they don't have a care person with them, that they're completely excluded from that. When it comes to digital solutions, if I may make just a couple of points on this, because we have the people in the room, that digital solutions for patients means across the spectrum. So if there are any AI technologies that minimizes the burdens on clinicians, that it gives them more time with the patient, that's beneficial. So anything that can be automated is beneficial. What we've learned from listening to a broad spectrum of neurological disorders is that 94% of people would recommend that they are also referred to a psychologist or like a counsellor. It depends on what country you're living in, what term that you use, because we really needed a better integrated care approach. And if we talk then more at the higher end of things, if we look to the world of diabetes, there's a lot done in personalised medicine with the digitization of being able to administer your insulin appropriate to your needs. The same could and should be applicable to neurological patients as well. But again, if I bring it back more to the everyday level, digital solutions that support mobility, communication, conversation, everyday life, we see so many of these that are, you know, startup spin-offs out of universities, and so many of them fail because of a lack of communication and collaboration with the patient groups that they are supposedly being built for. And if those communications were held early on in the process, a lot of these that are in development wouldn't be failing. And I can tell you, we're flat out being asked to be on panels. I think between myself and our president, in Europe alone, we have reviewed over 170 different types of different digital solution type technologies. And, you know, so few of them are actually going to make it anywhere. So again, communication between yourselves, whoever the tech people are, is also of critical importance as well, so that time is not wasted for the people who all of these products are supposed to be being built for.
And isn't it true there are more apps for health, second only to, well, you can guess, out there, that there's such a proliferation of health apps, and they've got to be got right. I thought it was a really interesting point. Temitope, you were talking there about the inequities. Is this really right? Up to 90% of the burden of neurological disorders, brain disorders, fall in the lower to middle income countries. Is it really that high? And if so, wow, how would you address that? Where do you begin?
When to start was 20 years ago. And the next best time to start is now. And I want to believe that is why we're doing this. It's important that we understand the huge impact that this is going to have on a lot of people. About 2/3 of the world lives in LMIC, and you're saying 90% of them having neurological diseases. One is very scary, even from where I come from. 2050 is just few decades down the line, and by then, it's projected that neurological diseases in my country will be like 3 times what we already have at this moment, and 3 times faster. You can imagine the disability life year that we are going to be experiencing. A lot of people living with disabilities and quality of life really, really going down. So, but we need to have concrete data, like he mentioned, so that we can start making appropriate intervention. And we were not going to wait until the disease appears or until the presentation comes. You're already doing school education, talking about it, preventive care, prevention, risk reduction, from before the symptoms develop. By doing risk reduction, practicing risk reduction, we can reduce this by 40%.
Wow.
Yes. So if at this point, if you ask me, what do we need to do? Education, awareness, creating huge awareness and also advocacy with the government to set up the right treatment plan for those who already have it. One of the issues about neurological diseases is that oftentimes you don't have treatment for it. So people ask me, you've made this diagnosis, what next? So that actually, for the fact that we don't have treatment for it, can actually pull people back from coming forward. But if we know what works, which is risk reduction, lifestyle modification, and we're able to put it out there instead of waiting for the diseases to manifest, then we'll be reducing the burden, I want to believe, by 40%. And that's a huge one for us. So education, advocacy, and creating awareness.
And in terms of setting targets, if you've got somewhere like the World Health Organization, Giancarlo, the WHO have got a global action plan to prioritize brain health over the next decade. Is having that sort of agenda, that sort of target, going to make a difference? And are we anywhere near heading in the right direction to achieve those goals?
Well, if you ask me that is an action in isolation, I will be very pessimistic about the impact. But it has to be in concert with many other initiatives. So one of the key aspects here is really to try to have a concerted action in the definition of protection of brain. Without this concerted action in isolation, no one may really believe to be enough powerful to change what is the environment. It's like what you can call a combination therapy. So we need to act from a different point of view. Think about one gigantic problem, that is the aging population. Aging population means that a lot of people who are not disabled, they are not affected by a specific disease, but they will not be able to take advantage from the increased duration of life. Because there is a dissociation between the physical state and the mental state. If you are not able really to do what she said, so start since the beginning with the education and with the protection in order to have the third phase of the life with an appropriate quality. Maybe I'm worried because I'm there, but it is clear that it's becoming a gigantic problem. You have a lot of papers speak about epidemic.
And Orla, with your organization, EFNA, working throughout Europe, you see different healthcare systems, you see different countries. One of the things in the WHO's Global Action Plan is to have a national strategy. What sort of difference would that make, and how could it be adapted to each of the countries?
So to answer that question and to pick up on what was already said, so there's others in the room here as well who have collaborated with us and with a global partnership called One Neurology to really push for the inclusion of neurology and other neurological disorders into what was originally going to be a global action plan for epilepsy. So we're very grateful and thankful to the WHO that it is a global action plan for epilepsy and other neurological disorders, but as we've just heard, it in and of itself is a global action plan like any other. And what actually people need, what patients' organisations need, what families need, what national entities need is the national data. Because if you don't have national data, nothing is going to happen. So yes, when it comes to the Global Action Plan, patient organisations, umbrellas like ourselves, we can absolutely support and encourage and create advocacy tools and policy initiatives that can be disseminated across different countries. I suppose there's probably 6 countries in Europe that have relatively good brain plans, if you like, but unless there is the national data that can be utilised at that local level, it's going to go nowhere. Like, you're completely right. And that's not to dismiss the fact that the Global Action Plan is great to have, but it's a tool. It's something that we can leverage, but it's only step one.
I want to thank our panel, our speakers here, for the amazing contributions. And as I say, I very much hope that this will spark discussions that you take on through the evening and right on through this Brain Health Collaborative that you're all signing up to. And I hope we'll get a little bit more commitment, that long-term commitment that's going to be needed to see this through because of those powerful statistics that we've heard.